Good evening.
Hi.
I'm John.
Carissa.
Okay. All right. Oh, and how's your wrist doing?
It's doing better.
Okay. It's not hurting too bad then.
No.
Okay. Good. I assume the doctor prescribed pain medication for you.
Yes.
Okay. Good. So tell me, have you ever had a cast before?
No.
No. Okay. Any friends? Nothing like that. That
No.
happened? Okay. Well, I'll tell you just a few things in brief. Actually, you have to take care of it while you have a cast on. The three words I want you to remember are ice, elevation, and movement. Okay? I'll ask you those again later.
Okay.
Okay. All right. I see you got an ice pack. It looks like it's got a bit of huge bump in there. Is it making it comfortable?
That's good.
Keep it on for a couple of days. That'll keep the swelling down. Okay. And basically a cast, you know what it's for, right?
To heal my bones.
Right. It keeps it from moving too much so that all the muscles and bones around those joints that are going to pull on the broken bones, otherwise causing muscle spasms and pain and gratings and a horrible grating sensation you get,
Yeah.
it'll reduce that. And it'll help your body actually heal faster. So, real quick, I want you to stand up and for me. Okay. Excellent. You know what you did right? No, this is good. Some people try to bear weight on it.
Oh, really?
All right. And that cast will take a good 2 to 3 days until it's completely solid.
Yeah.
So make sure you don't push on. Obviously, I think, you probably won't have a hard time with that because it's just for your wrist. Okay. Also, what were those 3 words again?
Ice, elevation, and movement.
Good. You have the ice. That's good for 2 days. Elevation, you got the sling on. It's around the level of your heart, right? And so it's elevated. And movement. Can you move your fingers for me? Like that? Okay. Can you open and close your hand pretty well? Okay, good. How about, can you roll your shoulder, or is that too discomforting?
It's okay.
Okay, not too much. Okay.
Yeah.
Not painful? Okay. You'll need to do things like that to keep the circulation and the swelling down. And also, you've heard the expression, whatever you don't use, you
Lose.
Yeah, you don't want that. Because actually, you're going to have this sling on at least 6 weeks. So keep in mind that you're going to need to keep it moving so that, you maintain your strength and your muscle tone. Okay. Do you have any other questions?
How do I take a shower with the cast?
Good. That's very important.
Yeah.
Plaster of Paris, right? This is what this is made out of. It's going to... Water will destroy it, right? It'll fall apart, kind of like that, clay project you made in high school, right? In art class, probably. You've done that, right? Okay.
Yeah.
I just assumed. So, yeah, what you need to do is you have some saran wrap at home, right? Okay, plastic bags.
Yeah.
Just wrap your arm in that. As long as it's tight and the water can't leak in there, you'll be fine. You want to keep the water out and from getting wet, and that'll do it. So make sure it's just all the way down, completely covering the cast. And if you have to, rest it on a table, take the sling off and then wrap it, that's fine. But just keep it elevated, keep it wrapped up, keep it waterproof, you'll be good. Now, are you thinking what I'm thinking?
Yeah.
Okay, yeah.
What if it gets wet?
Right, right. Especially because it's summer soon, right?
Yeah.
And it's going to get hotter and you're going to get sweaty.
Yeah.
Right. So you need to refrain from things that are going to keep you from getting too sweaty. Because if it sweats under there, clearly it's going to make quite a stench, right?
Yeah.
You don't want that. So what you'll want to do is take a towel, dab it dry, and then the other thing you can do is after that, if it's wet underneath, go ahead and take a hair dryer, what you use to blow dry your hair, put it on a low setting, and just blow into the cast.
Okay.
Now, don't try to take an item or a towel and on a stick or something and jam it in there. It's a huge infection risk, so don't do that. You don't need to. Yeah, I mean, I've seen people do that. So it could actually disrupt the cast and your skin. So don't do it. It's made to be tight for a reason.
Yeah.
Okay. Any other questions?
I think that's it.
Okay. Then it seems like you got all the other information we covered is already in here for you. That should be it. all reasons why you need to call a doctor,
Yeah.
obviously. That's right there. We covered some of those.
Yeah.
If the pain gets worse, it gets numb or tingly, excuse me, too much pressure, then give us a call. Okay. All right here. Go ahead and sign for me,
Okay.
and I'll take this form, and you have the rest of it. All our information's yours. Here you
Okay.
go.
I'm a lefty now.
Sorry, I take it you're right-handed. Okay.
Yeah.